I'm Dr. Suzie Bergman, and I'm here today to talk a little bit about my experience as a dentist, a POS instructor, and someone who's interested in helping patients to have healthy and beautiful smiles. So if we go back to the very beginning, I was a 19-year-old college student, and I didn't know what my major was going to be. I was interested in medicine, but as a sophomore in college, I was involved in a very crazy fluke accident where my friend's car flew backwards and threw me over a 50-foot hill and came down on top of me, and I sustained very severe damage to my temporomandibular joints. So a couple years later, I was a dental student, well, maybe more like 4 or so years later. And as a dental student, we realized how severe the extent of my injuries were. So for several years, I went from one specialist to another trying to figure out what we were going to do about this. And in the meantime, I became a dentist, and I was practicing general dentistry, but I was not completely excited about doing fillings and, just run-of-the-mill mechanical type procedures. Well, as the years progressed, I went from doing more pediatric procedures to realizing that I was very interested in orthodontics. And so I began my POS education in 2009, and I remember sitting in the very first class that I took for POS, and I just got so excited. I was like, this is my thing. I'm going to do ortho. And I absolutely loved every minute of my basic training. I went on to do advanced training and then was asked to become an instructor for the company. So I started teaching, and I was teaching the assistant class until I finished my new instructor training to become a full-fledged POS instructor. And for a few years, I really focused on ortho, but I also had been going through my own personal journey with my TMJ problems, and I started seeing a lot of TMJ patients as well. And what I began to realize is that as general dentists, we need to know everything about dentistry, and not only dentistry, but we need to know about the whole person in a primary care type of approach, so that we're not separating the mouth from the body, and we are actually treating the whole person, because lots of dentists are aware that we can find things in the mouth that point us to systemic disorders like diabetes or health, heart type of problems. And as someone who is treating a lot of patients with temporomandibular disorders, I came to see how important it was that we really treat our patients in an integrated type of approach. And so after my initial diagnosis that I was a TMJ patient, I was sent to pretty much every department in the dental school, and the orthodontists didn't want to treat me, the oral surgeons didn't want to treat me. I kind of was left in this no man's land where I wasn't a dental patient and I wasn't a medical patient. And over time, I realized that my story was not unique, that many patients with these types of disorders find the same problems. And unfortunately, what happens to patients with temporomandibular disorders is that they develop other disorders, which are chronic overlapping conditions. And some of those would be poor sleep due to pain, or dietary issues that lead to gastrointestinal disorders. And so I kind of just became self-educated, and I started learning what I needed to know in order to improve my health. And then over time, after a couple of very unsuccessful surgical procedures, I came in contact with Dr. Sandy Ratner, who is an oral surgeon here in Orange County, and he has a foundation with the McGann Postgraduate School of Dentistry called the McGann-Ratner Foundation, and he performed my total joint replacement surgeries, which I just recently had the third of the 3 procedures, so I'm still healing from that, but I finally feel like I've gotten to a place where I see the light at the end of the tunnel, and I hope to not only be a healthier person in the future, but to give hope to other people who are suffering with the same types of disorders. So when someone says, I have TMJ, that's kind of like saying, I have knee or I have elbow. The joint itself is the TMJ. And we have a right one and a left one that are connected by the mandible, which makes this joint different from every other joint in the body. So with the TMJ, when one side is affected, we can't just rest that side. We actually have to figure out how our body is compensating because both sides are working together. So a better term is temporomandibular disorders rather than TMJ, which is temporomandibular joint. And what a lot of people don't realize is that that term TMD is an umbrella term for about 30 different disorders, all affecting the temporomandibular joint. Some of the disorders are very acute in nature. They may be more muscle related, and they can be resolved within a matter of weeks sometimes. Other disorders, as we go further along the continuum, may become chronic. And once the pain has become chronic, the condition is much more difficult to treat. And depending on whether the condition is mostly affecting muscles or joints, the treatments are going to be very different. So when we talk about what causes TMD, it is multifactorial. It can affect more than one system in the body, and it is a musculoskeletal condition. And things like trauma or genetic predisposition, things like poor posture or other chronic overlapping conditions such as arthritis can all affect the temporomandibular joint and lead to temporomandibular disorders. Here are some tips for patients with TMD. First of all, you want to think of this as any other joint in your body. If you had a sprained ankle, you wouldn't run a marathon. So when your jaw joint is bothering you, you need to give it a little bit of rest. So try to chew things that are soft, take smaller bites, and have shorter episodes of chewing. So those 3 things can help a lot with the discomfort that comes from the mechanical use of the joint. Other things that we do that cause our jaw to hurt are talking, singing, yawning, smiling, facial expressions, even emotions that we have like crying can cause the joint to hurt. Because of that, we have to be really mindful that we are taking care of our entire health as far as mental health, physical health, and oral health. We want to have our dental appointments be shorter appointments whenever possible, or take breaks during those appointments. You can use things like ice and heat to help with inflammation and swelling. And you want to make sure that you're taking good care of your sleep hygiene, because when you're not sleeping well, that's going to affect your mood, and that's going to put you into a state of fight or flight so that it's difficult for you to actually relax. And relaxation is one of the most important things we can do, especially for the muscular component of disorders. For doctors who are interested in learning more about temporomandibular disorders, I have a few tips, and one would be that you always look for things that are evidence-based protocols and understand that some of the things that we were doing in the previous century, in the 80s and 90s, have been proven not to be very effective. So always look for things that have research to support them or have been shown by providers and patients to be effective. In other words, if you see something that's a fringe type of treatment, you need to think twice about whether or not you want to recommend that to a patient. And if the treatment is reversible, then you know that you're going to have a patient that is not going to suffer long-term consequences. But if you give them an irreversible treatment, then that's putting them further towards procedures that are more invasive, which is what we try to avoid for our TMD patients. We have some lectures on alignermaster.com. We have instructors here who do TMJ consultation, and we're always happy to help you manage your patients who have these type of chronic pain disorders. General dentists have a very big role in diagnosing and treating temporomandibular disorders, or TMDs, because we are the ones who patients come to when they have orofacial pain. Sometimes the patient will have their primary complaint as headaches, and they might end up in a neurology office, or they might think that their pain is coming from their ear and go to an ENT. But in general, patients come to the dentist saying, I have clicking, I have popping, it hurts to eat, it hurts to talk. What can you do to make me feel better? And unless we know what we can do to make them feel better, in the past, what would usually happen is the dentist would stick a piece of articulating paper in the mouth and see if there were any premature occlusal contacts. Well, in the past several years, we've learned that occlusion really isn't the primary source of TMDs, and so that's not really the approach that we want to take. Sometimes when a dentist sees a patient with TMD, they think, well, I need to do something for this patient, so they make an occlusal guard or splint, and they give the patient the appliance without any real thought to what to do afterwards. And what we know now is not every TMD patient needs an occlusal guard, and sometimes the occlusal guard might actually make the condition worse instead of better. So the dentist needs to be appropriately educated on what our role is, and when it's time for us to say, this is out of my scope and I need to refer the patient to somebody who has more training, such as an orofacial pain specialist. And we do need to be careful that we don't refer patients to someone who is only going to be interested in providing treatments that require the patient to keep coming back, because really our goal should be that we make the patients better so that they don't need to keep coming back. November is National TMJ Awareness Month, and this is a great opportunity for us to educate ourselves and learn what we can do for the 35 million Americans who are afflicted by these disorders. TMJ, or temporomandibular joint disorders, are not only very common, but they are something that is not very well understood in the dental or medical communities due to a lack of research for this joint compared to other joints in the body. So at this point in time, we're looking at the TMJ from an orthopedic approach, just like we would for knees, elbows, shoulders, and those types of things. And the thing is that this is the only joint in the body that is treated by someone outside the scope of orthopedics. So it's treated mostly by dentists and oral surgeons, and there are times when we need to get members of the medical community and our ancillary service providers involved, especially PT who has extra training in the head and neck region. So during the month of November, this is a great time for us to learn as much as we can so that we can help our patients improve their quality of life and their healthcare outcomes.